Hello and welcome to NCTV episode 81, and this one is about swimming injuries. At the time of recording, we're at the end of June 22, and the summer is always a popular time for people to be taking to the sea, pools, lakes, rivers, streams, and even ponds to partake in one of the most popular sports in the world. Swimming is great and it's considered a low impact sport due to the fact that the water supports a large percentage of your body weight. And exactly for that reason, it's often used in the rehabilitation of injuries to joints affected by weight bearing, i.e. the back, hips, knees and ankles. However, if you swim a lot for general fitness or in competition, the risk of developing an injury is high because of the repetitive and forceful nature of the shoulder revolutions, as well as stress on the back to hold you level in the water. In fact, 84% of regular swimmers suffer from overuse type injuries. That doesn't mean to say that you should avoid swimming, because the benefits do far outweigh the risk of injury. Some of these benefits might range from simply finding a quiet place for stress relief, to helping increase your general fitness, or even fulfill your desire to win competitions. To highlight a few more of the common areas of injury that may cause you to sink rather than swim, and these tend to be in the shoulder, knee, neck and back. Starting with swimmers' shoulders, and this is the most common type of swimming injury. Given that swimmers annually perform hundreds and thousands of arm rotations, it should be no surprise to learn that this type of work and frequency places a lot of stress on the shoulder muscles and joints. During one arm revolution, the shoulder is in a position of impingement, where it's pinching structures, for 25% of the time. So you can see why multiplying that millions of times a year can lead to cumulative damage. Research has shown that shoulder injury is common across all strokes at any age or level of swimming competition. So it doesn't discriminate, and this is probably due to the fact that with all strokes, between 50 to 90% of the power generated to propel you forwards comes from the arms and shoulders. Swimmer's shoulder can present with pain at the front or the back of the shoulder, which can travel either down the arm or up the neck during swimming, or even when lying in bed on your side at night. Aside from overuse, it can also be caused by poor stroke technique, weak muscles, poor posture, stiff upper back, and a lack of shoulder blade stability. To treat it, manual therapy can help to reduce the pain and improve the mobility. You can also do rice and strapping, stretch the tight muscles, improve the mobility in the upper back, strengthen the weak shoulder muscles, and correct your posture. On to the next common issue, which is swimmer's knee. This is more specific to breaststroke swimmers, who usually develop pain on the inner side of the knee. Again, this is due to repeated loading of the knee joint in unnatural angles, resulting in injury over time. This can lead to swelling, sensitivity and stiffness. Some of the causes may be weak muscles around the hip and buttocks, having a wide kick and stiff ankles. Finally, neck and back pain, which is also common in swimmers. These are often closely related to poor posture on land. Swimming may not be the primary cause, the pain merely expresses itself in the water. Strong stabilising muscles on the front of the neck, as well as strong core muscles, are crucial to ensure good alignment of the vertebrae and reduce strain on the joints. Identifying problems with your stroke is crucial, but remember to look elsewhere too, to focus on activities you do most during the day, such as sitting, driving, lifting, carrying and computer work. If the ergonomics of these activities are not addressed, you will battle to completely eliminate your pain. Bilateral breathing can particularly help with neck pain, and implementing a body roll can take some strain out of the lower back as well. Also, improving your rhythm and stroke alignment may be advisable. Outside of the water, you may also find spine mobilization or manipulation helpful, as well as dry needling or massage. When it comes to rehabilitation, injuries can take up to 6 weeks to recover, even longer for those left untreated initially, which can require a prolonged rehabilitation, often 3 months or more. Shoulder surgery is not that successful in swimming injuries either. Often the exact cause of the pain is not identified and therefore not corrected. post-surgical rehabilitation of the shoulder can take as long as 6 months. So whatever you do, don't leave a niggle and accept it as part of being a swimmer. You may have to stop swimming for a while, or at least reduce the intensity of or duration of your sessions, but by doing this it will help to give you the best chance to address the problem before it turns into anything more serious. Muscle imbalances are one of the main issues when it comes to swimming injuries. And this is partly due to our daily routines consisting of activities like sitting for long periods at desks. Add to this the repetitive nature of swimming. Certain muscles then become extremely well developed, while other muscles get really weak. Having balanced muscle strength around the joint is crucial to support it, allow fluid motion, and maintain good alignment of the moving parts. Identifying muscle imbalances and applying strengthening or stretching exercises is key to preventing and managing an injury. This is where a physical therapist such as an osteopath like myself can help, and this will be to assess this and teach you appropriate exercises. Hands-on mobilisation can also help to restore balance to tight, shortened muscles or restricted joints. The second key step to preventing injury is identifying problems with your stroke that could be overloading or straining certain structures. One final thing to mention is that, as with most sports, it's always a good idea to perform some prehab. This involves specific stretches and strengthening exercises on a regular basis as part of your daily routine or training, with the specific goal of preventing injury. Having regular massage or seeing a physical therapist to mobilise or loosen any stiff, tight structures may help to avoid developing a serious debilitating injury. So that's it for this week's bite-sized bit to help your health flourish. I'll see you next time, but bye for now.